Hello friends, welcome to a new lecture today on urinary tract infections. In our last class, we have learned about the pathogenesis of urinary tract infections. In this class, let us learn about the clinical features of urinary tract infections. Most of the urinary tract infections, they can be, number one, asymptomatic. Most of the times they are asymptomatic. If they are asymptomatic and if the person is not a pregnant woman and if the person has no structural abnormalities, in such cases it is not necessary for treating the disease. And if symptomatic, the symptoms differ based on the infection, whether there is cystitis or whether there is pyelonephritis or whether there is prostatitis. So based on the difference, the symptoms will vary. So just let us see the symptoms of pyelonephritis first. Pyelonephritis, the person will have low grade fever. And there will be, if this is the back, there can be here lower back pain. Okay, lower back pain can be there, or costovertebral pain can be there, or pain in the loin can be there. Okay, so these are different pains, different areas where we have pain. Okay, if this is severe, if this is mild, these are the features, only low grade fever and pain. If it is severe, then the person will have high grade fever. There will be fever, but this is high grade, and there can be rigors. Fever is associated with chills and rigors, and there can be nausea, vomiting, and there can be a loin pain. Frank loin pain or flank pain can be seen. So these are the different features which we see if there is pyelonephritis. Now, this pyelonephritis, sometimes it can be there are some special types of pyelonephritis. The special types include, number one, emphysematous pyelonephritis, number two, xanthogranulomatous pyelonephritis. In emphysematous pyelonephritis, there is presence of gas in the renal and also pararenal perinephric tissue. That is emphysematous pyelonephritis, where there is gas in the renal and also the surrounding tissue, that is perirenal tissue. And there is one more type where there is xanthogranulomatous pyelonephritis, where there is formation of suppurative tissue in the renal tissue, suppurative destruction of renal tissue. That is xanthogranulomatous pyelonephritis. So these are the two special types of pyelonephritis. In emphysematous pyelonephritis, there is presence of air in the renal and also the perirenal tissues, whereas in xanthogranulomatous pyelonephritis, there is suppurative inflammation or suppurative destruction of the renal tissue. So that is xanthogranulomatous pyelonephritis. So these are the two different types of pyelonephritis. Okay. Now, if the infection is in cystitis, okay, so this is pyelonephritis. If the infection is in bladder, then we call it as cystitis. So in cystitis, what do we see? In cystitis, there are features of lower urinary tract infections. Like there can be dysuria, there can be increased urinary frequency, and sometimes there can be urgency. Okay, these are the typical symptoms. And sometimes you can also see nocturia or hesitancy, okay, or suprapubic discomfort. So these are the, if you see the features, the clinical features of both pyelonephritis and cystitis vary a lot. It's really very easy to differentiate both of them. Okay, so how are you going to now, if it's complicated urinary tract infections, the person may have UTI, all these symptoms. Along with these, the person is either a pregnant woman or, so no, not a pregnant woman, is either, the person has all these. Along with that, if there is anatomical predisposition to urinary tract infections or presence of catheters, in such cases, we call it as complicated urinary tract infections. When do we call it as complicated urinary tract infections? When there is all these uncomplicated urinary tract infection symptoms plus presence of either anatomical abnormalities which will predispose to urinary tract infections, or presence of foreign body in the urinary tract, like presence of catheter or a stone or some other foreign body in the urinary tract, infection in the urinary tract. All these will then this is called has complicated urinary tract infections. Okay, now how are you going to diagnose it? Diagnosis, the best is urine culture. Urine culture and sensitivity. Microscopy, urine, because the infection is in the urine, we will have to do first that the best thing is doing urine microscopy and culture. So this is the best investigation that we can do. Okay, the best investigation is urine culture. There are also some dipstick tests which are available which will detect urinary tract infections. Okay, now how are you going to treat the urinary tract infections? As I have said, the treatment is mainly depends on whether it is complicated or uncomplicated. Even in uncomplicated, whether she is pregnant or non-pregnant, or whether there is symptomatic. So I'll just tell you all the treatment aspects of urinary tract infections. So I'm writing all the treatments in my brown pen. Okay, so if it is asymptomatic, you'll have to see whether the woman is pregnant or non-pregnant. If it is pregnant, you will have to treat it. If it is non-pregnant, then no treatment is required. Okay, if it's asymptomatic. Okay, if it is symptomatic and uncomplicated and symptomatic, then you will have to assess it, and then you will have to treat it. Okay, if there is, it's simple, based on the symptoms you can tell whether it is pyelonephritis and cystitis. The treatment differs depending on it. Okay, whenever there is one more thing, whenever the person, in complicated one, if the person has this foreign body or catheter, then the best treatment is remove the catheter. If we have to put the catheter for sure, then at least exchange the catheter with the other one. Okay, then if it is uncomplicated, you'll have to treat it. If there are some anatomical abnormalities, if they are treatable, so those anatomical abnormalities can be treated. So now, what are the treatment options? What are the regimens which are available for pyelonephritis? So there are many drugs which are available for uncomplicated and complicated pyelonephritis, complicated complicated urinary tract infections. The most common drug which we do for uncomplicated pyelonephritis is nitrofurantoin, which is called as urinary antiseptic. So let me just write the names of the drugs. So we use many drugs. So I'll just write some important drugs here. First, uncomplicated. If there is uncomplicated cystitis, in such situation we give trimethoprim and sulfamethoxazole. So this is the first line drug which we give for uncomplicated cystitis in women. Okay, the second drug which we can give is nitrofurantoin. So this nitrofurantoin, it is given before, it used to be given as a 7-day course, but right now it is only given for 5 days. It is also called as urinary antiseptic, so it is also the first line drug. It can be combined along with trimethoprim also. So these two are the first line drugs. The second line drugs include one, fluoroquinolones. Fluoroquinolones, they can be ofloxacin or ciprofloxacin or levofloxacin. These fluoroquinolones will will kill the organism. So there are many side effects like nausea, vomiting, diarrhea, headache, insomnia, etc. In elderly, there is increased risk of Achilles tendon rupture. Okay, so these the second line drugs which are fluoroquinolones, but there is resistance to fluoroquinolones is also developed. So there is one more drug which can be used. These are beta lactam agents. In the beta lactam agents, we generally use pivmecillinum. This is a beta lactam agent which is used in urinary tract infections. We can also use a urinary analgesic which is called as phenazopyridine, but the side effect of this is nausea. This urinary analgesic, it is used along with either urinary antiseptic like methenamine, methylene blue, or it is used along with urine acidifying agent which is sodium phosphate, or it is used along with antispasmodic agent like hyoscyamin. Okay, so these are the different drugs which are used for uncomplicated urinary tract infection. Removing all these, the best drugs which are used are trimethoprim, sulfamethoxazole and nitrofurantoin. For pyelonephritis, this is uncomplicated, and that too we use it for cystitis. Okay, that is one. First, the second one for pyelonephritis, the drugs which we use for pyelonephritis include the first line drugs are fluoroquinolones. Here, trimethoprim, sulfamethoxazole are not the first line drugs because they are the E. coli, the Escherichia coli organisms which will produce pyelonephritis most commonly. They are resistant to these sulfamethoxazole and trimethoprim and sulfamethoxazole. As a result, because the E. coli producing the pyelonephritis are resistant to these antibiotics, we cannot give trimethoprim sulfamethoxazole. So the first line in pyelonephritis is fluoroquinolones. So these fluoroquinolones can be given either orally or parenterally, and the best fluoroquinolone is ciprofloxacin, which we generally give 500 milligrams twice daily. If the organism is susceptible to trimethoprim sulfamethoxazole, only then we can give trimethoprim sulfamethoxazole, and that too double strength tablet. Okay, if we think that the organism is susceptibility, if we know that the organism is susceptible to sulfamethoxazole and trimethoprim and sulfamethoxazole, then you can put him on that. Okay, if the organism is susceptible, if we don't know the susceptibility, and still if we have already used trimethoprim, sulfamethoxazole is already used, then you can use one more drug which is ceftriaxone. If trimethoprim, sulfamethoxazole is already used, then we can use ceftriaxone. Okay, beta lactam agents are also available, but they are less effective in these organisms. In these organisms, beta lactam agents are less effective than fluoroquinolones, so we don't use them much. Then there is one more parenteral preparations which are available. For parenterally, we can give either an cephalosporin can be given, or we can also give a carbapenem. So these are the different drugs which can be given for pyelonephritis. Okay, if there is urinary tract infections in pregnant women. Think that there is urinary tract infections in pregnant women. In urinary tract infections in pregnant women, we cannot give sulfonamides or we cannot give fluoroquinolones, because sulfonamides, it has teratogenic effect and at term it can develop kernicterus, whereas fluoroquinolones, they can cause fetal cartilage abnormalities, and as a result we don't use either sulfonamides or fluoroquinolones. What we generally use in pregnant women is nitrofurantoin, which is a urinary antiseptic and it is really very safe, and there is ampicillin, which can be used, which is safe, and there are also cephalosporins are also safe in these individuals. So these are the different drugs which are used in these urinary tract infections in pregnant women. So if there is asymptomatic pyelonephritis, we generally use ampicillin and cephalosporins, and if there is asymptomatic cystitis, these we use if there is asymptomatic cystitis, okay, in pregnant women. And if there is pyelonephritis, then we use beta lactams plus or minus aminoglycosides. These are used if there is pyelonephritis, because pyelonephritis is a little severe condition. So if there is pyelonephritis, we use beta lactams and aminoglycosides. Now UTI in men. In men, most common cause of UTI is prostatitis. That too, febrile UTI is prostatitis. So the main aim is to eradicate this prostate infection. So you will have to give treatment by the same as uncomplicated way, where we use trimethoprim, sulfamethoxazole and fluoroquinolones. And the next group of drugs which we can use here is for complicated urinary tract infections. We have completed about uncomplicated one. Now complicated urinary tract infections, for that we will always have to do culture and sensitivity. Don't forget to do culture and sensitivity. First, before we do culture and sensitivity, we can start him on empirical therapy, and then you can do culture and sensitivity, and the treatment is based on the organism. You'll have to treat based on organism. If there is xanthogranulomatous pyelonephritis, as I have said here, then you will have to do nephrectomy. The suppurated part should be removed. That is the main treatment for xanthogranulomatous pyelonephritis. And if there is emphysematous pyelonephritis, then you can do percutaneous drainage of air if possible. And then if it is not resolving, then you can do nephrectomy. Either partial nephrectomy can be there or complete nephrectomy can be done. Okay, so these, if there is a catheter, then as I have said, if there is catheter, you will have to remove the catheter. Okay, then if there is asymptomatic, only in pregnant women or those who are undergoing surgery or in immunosuppressed, even in immunosuppressed individuals, in such situations you will have to treat it, or else there is no need to treat it. So these are the different treatment options which are available for urinary tract infections. So thank you guys. For the prognosis of urinary tract infections is really good. There is no need to worry about the prognosis of urinary tract infections. Prophylaxis of urinary tract infections, I forgot to mention that. So there is, we can also give prophylaxis for urinary tract infections. This is given if there is recurrent UTI in a woman. Women are mostly prone to urinary tract infections, and if there are recurrent urinary tract infections in a woman, then we can give prophylaxis. This prophylaxis can be continuous prophylaxis or it can be post-coital prophylaxis. Okay, or there can be patient-initiated prophylaxis. In patient-initiated prophylaxis, if the woman thinks that if the woman had fever or some infection, burning, micturition, in such situations, the mother can, the woman can start the medication on her own after giving the urine for culture and sensitivity. So that is patient initiated therapy. In continuous prophylaxis, we give trimethoprim, sulfamethoxazole, or fluoroquinolones or nitrofurantoin are given, but they are given in lower doses in order to prevent the resistance. So they are given in lower doses for nearly 6 months, and then it is discontinued after 6 months. So these are the prophylactic. These are used for the prophylaxis of urinary tract infections. Okay, so this is about urinary tract infections, guys. Thank you guys for watching my lecture. If you have any doubts, please comment it in the comment section. If you feel something is inadequate in this lecture, even then comment it in the comment section. Thank you for watching my lecture. Thank you.